All right, today we're going to walk through a typical patient interaction using the PATH software in an office setting. So this is how we would use the software to come up with a treatment regimen while a patient's in the office with us. So we'll start with a female patient who's age 43 with a current A1C level of 8.1. The patient's currently taking glyburide twice per day, metformin twice per day, and exercising. And as part of any regimen that we come up with, we want to make sure that the patient continues to exercise. So every regimen that PATH suggests needs to include exercise. We're also going to make sure that we don't count on diet to affect the patient's A1C level. We would typically exclude diet as an intervention or as a suggestion based on past history with this patient of diet not working to lower the patient's A1C. In terms of drug intolerances, you can select a lot of things here. You can eliminate injectables or insulin. Just to show you how this works, I'm going to eliminate Tansium, which I know is no longer on the market, but it'll give you an example of how the drug intolerance feature works. For comorbidities, the patient has high LDL, hypertension, and hypertriglyceridemia. In terms of side effects that the patient is susceptible to, it's GERD in this particular case. So we'll go with that. We might add more comorbidities on later on to show you how PATH works with additional constraints. This is the patient's current insurance plan. We're going to make sure that the regimens that we suggest fit into the patient's insurance plan coverage. And we're also going to use the insurance plan coverage to calculate the patient's out-of-pocket cost for their regimen. The patient's insulin resistance looks good. Patient's beta cell production is good. Body mass index of 32, which is, I believe, obese for female patients. We're going to set the eGFR rate for kidney function to 60, so good kidney function. And just to show you how PATH works, we're going to start with a very high maximum monthly out-of-pocket cost. We're going to say it's $2,000 for this patient per month. We're going to restrict this as we walk through the example, but we're going to start off with something high so you can see how PATH processes different constraints around cost. If I scroll back up here, click Display Solutions, PATH is going to go out and look at every treatment option that fits all of these different conditions. Here it analyzed 70,470 viable treatment options. Came up with this one that costs $175 per month. Gives it a score of 95.4 out of 100. And it recommends these treatment options. You can click on any of these to get more information, including dosing, side effects, FDA label access, and things like that. PATH thinks that if the patient followed this treatment regimen, her A1C level would be 6.63, again at a cost of $175 a month for the patient. In terms of weight effects, we think that this particular regimen might promote a bit of weight loss for the patient, which again is good because the patient has a body mass index of 32. Here are all of the positive and negative side effects associated with the treatment options in this regimen. You can see that some of them address the patient's comorbidities, hypertriglyceridemia, hypertension, and so on. Others are simply reminders about what the treatment options are contraindicated for. So you can go through each of these side effects when you discuss trade-offs with the patient around each of the treatment options. So let's say that the patient says, you know what, I don't really have $2,000 a month. I've only got $200 per month for my regimens. Let's change this to $200 and see what the patient comes up with. And we'll say that $200 is the absolute maximum that the patient wants to spend, but if they could spend less, that would be good. In this case, the software thinks that there are 30,784 options that fit this new criteria. This one costs the patient $60.45 per month, has a slightly lower score than the other regimen that we saw. Here are the treatment options available. The patient's projected A1C under this regimen is 6.93, again at a cost of $60.45 a month. And the regimen would also promote weight loss, we think. Here are the side effects that are associated with this particular regimen, again, along with reminders about what the regimen is contraindicated for. So this is an example of how PATH can come up with different options very, very quickly. I'm going to add in a couple more things now. Let's say that the patient has 2 additional comorbidities, congestive heart failure and coronary artery disease. And we'll see what PATH does with these new constraints. By the way, we would expect all of this information to be filled in by an EMR system automatically. The only things that we think that you'd have to fill in an office visit would be the things around cost. So in this case, when we add in congestive heart failure and coronary artery disease as comorbidities, PATH thinks there are 9,860 treatment options available for this patient. This one costs $135 per month. Here's the regimen. The projected A1C under this regimen is still good, 6.78. Again, $135 per month for the patient. And there is still some weight loss effect available from this regimen. Here are the positive and negative side effects. You notice that the regimen is designed to address the comorbidities that the patient has. PATH gives bonus points in its score to medications with a positive side effect related to the patient comorbidities. So that's good. Let's say that the patient looks at this and says, you know what, I can't afford up to $200 per month. I can really only afford $50 per month. That's an additional constraint. We'll put that in here and we'll click Display Solutions again. Here, PATH thinks that there are 130 treatment options that meet the patient's new budget requirement and all of the conditions that we came up with before. This one costs $44 per month. It's glimepiride and Toujeo. A1C level is 7, which is still at goal. But the big thing to note here is that this particular regimen may increase the patient's weight. So we think its weight gain effect is 4 on our scale of -10 to 10. And that is the kind of trade-off between cost and, say, weight gain that we think PATH is really good at facilitating in an office setting. So this trade-off between cost and side effects, for example, is something that the patient needs to consider when they're coming up with a treatment option. So let's say that the patient asks if there's any way that we can eliminate the weight gain and still get A1C under control with these comorbidities. And you remember that there are good coupons available. So we're going to add coupons into the mix here. We normally don't include coupons by default in PATH because we know that coupon use raises the system cost of treating patients, but the coupons are available for patients who need it. So if we click the Display Solutions buttons again here, we see that PATH now thinks there are 13,502 options available with coupons. This one costs the patient nothing per month because of some really good coupons for Lantus, Invokana, and Combiglas. The patient's A1C is 6.87 under this regimen. Again, costs them nothing per month. And this particular regimen also has a bit of weight loss for the patient. So from the patient's perspective, this is sort of the best of all possible worlds. It's free. It gets them to a lower A1C level, gets them to goal, and it also promotes a bit of weight loss. Here are all of the side effects that are associated with this regimen so that the patient is aware of, again, any possible trade-offs between the free cost and the side effects. So this is an example of how we can go through multiple different scenarios with things the patient is telling you as the office setting is happening, where you can customize the treatment regimen to fit the patient's needs.